Dr. Margaret F. Butler was a pioneering and well-respected leader in medicine, an ambassador to the specialty. In 1906, she was appointed chair of the Department of Otorhinolaryngology at Women's Medical College of Pennsylvania, being the first woman to chair an otolaryngology program in the United States. Dr. Butler provided a blueprint for future generations of women otolaryngologists to follow through her vision, skill, expertise, and fortitude. Dr. Berrylin June Ferguson was a surgeon-scientist who demonstrated a lifelong commitment to quality patient care and outcomes. She was a professor in the Department of Otolaryngology, Head and Neck Surgery at the University of Pittsburgh School of Medicine for more than 20 years. Dr. Ferguson evolved as an international leader in rhinology and sinonasal allergy and demonstrated an enthusiastic pursuit of excellence in all areas of her life. Dr. Charles Gladney was a pioneer in the ongoing mission for equity in medicine and a trailblazing mentor. He was the first African-American chair of a basic science or clinical department in the United States. Dr. Gladney was a practitioner and educator for more than 50 years, and his groundbreaking contributions in otolaryngology, education, and civil rights continue to reverberate through the generations of physicians he inspired. Dr. John Kirchner served as chief of the section of otolaryngology at Yale School of Medicine from 1951 to 1980. He was conferred an honorary membership in the European Laryngological Society in Rome in 1999 and was the first American member of that organization. Fluent in several languages, Dr. Kirchner was often invited to teach courses abroad and was an internationally recognized pioneer in laryngeal physiology and cancer research. Dr. Paul H. Ward served AAO-HNSF as first vice president in 1980 and as coordinator for continuing education from 1984 to 1989. During his distinguished 40-year academic career at UCLA, Dr. Ward was professor and chief of the Division of Head and Neck Surgery. He also was a consultant to the National Institutes of Health Director of Neurological Diseases and Stroke. Dr. Ward was a leading figure in head and neck surgery. Dr. A.G. Yanagasawa was clinical professor of otolaryngology at Yale School of Medicine and served the New Haven, Connecticut community for decades. He had a profound influence on the training of over 100 Yale residents, promoting clinical research and medical publications. Dr. Yanagasawa was a pioneer of many medical techniques and renowned internationally for his documentation of disease states and videographic techniques in otolaryngology.